Medical revalidation of Puerto Rico, clinical questions on muscarinic agonists, bethanechol, carbachol, methacholine, pilocarpine. 1. A 68-year-old man is unable to urinate after a prostatectomy. His bladder is distended and post-void residual volume is significantly elevated. Which of the following medications is the best treatment? A. Oxybutynin. B. Bethanechol. C. Tolterodine. D. Atropine. Answer B. Explanation. Bethanechol is a muscarinic agonist that stimulates detrusor muscle contraction, promoting bladder emptying. It is used for urinary retention. 2. A patient with glaucoma needs a medication to increase aqueous humor outflow. Which of the following would be most effective? A. Timolol. B. Acetazolamide. C. Pilocarpine. D. Atropine. Answer C. Pilocarpine. Explanation. Pilocarpine is a muscarinic agonist that contracts the ciliary muscle, opening the trabecular meshwork and increasing aqueous humor drainage. 3. A 40-year-old man with Sjogren's syndrome has severe dry mouth. Which of the following medications would be most beneficial? A. Scopolamine. B. Pilocarpine. C. Glycopyrrolate. D. Diphenhydramine. Answer B. Pilocarpine. Explanation. Pilocarpine is a muscarinic agonist that stimulates salivation and is used to treat xerostomia in Sjogren's syndrome. 4. A 30-year-old woman presents for asthma testing. Which muscarinic agonist is used for bronchial challenge testing? A. Methacholine. B. Pilocarpine. C. Bethanechol. D. Carbachol. Answer ethacholine. Explanation. Methacholine is a muscarinic agonist used in the bronchial challenge test to diagnose asthma by inducing bronchoconstriction. 5. A patient undergoes eye surgery and requires a drug to constrict the pupil for better visualization of the lens. Which of the following is most appropriate? A. Tropicamide. B. Phenylephrine. C. Carbachol. D. Atropine. Answer C. Carbachol. Explanation. Carbachol is a direct muscarinic and nicotinic agonist that causes miosis, improving visualization during ophthalmic procedures. 6. Which of the following muscarinic agonists has both muscarinic and nicotinic activity? A. Bethanechol. B. Carbachol. C. Methacholine. D. Pilocarpine. Answer B. Carbachol. Explanation. Carbachol has both muscarinic and nicotinic effects, which make it useful for glaucoma treatment, but less specific than other muscarinic agonists. 7. A 55-year-old man presents with urinary retention after undergoing hernia repair surgery. Which of the following best describes the mechanism of the drug used to treat his condition? A. Inhibition of acetylcholinesterase. B. Direct muscarinic receptor stimulation. C. A1 receptor blockade. D. B2 receptor activation. Answer B. Direct muscarinic receptor stimulation. Explanation. Bethanechol directly activates muscarinic receptors, promoting bladder contraction and relieving post-surgical urinary retention. 8. A 6-year-old boy accidentally ingests pilocarpine eye drops. Which of the following symptoms is most likely to develop? A. Tachycardia, dry skin, and dilated pupils. B. Bradycardia, sweating and diarrhea. C. Hypertension and urinary retention. D. Mydriasis and constipation. Answer B. Bradycardia, sweating, and diarrhea. Explanation. Pilocarpine is a muscarinic agonist that increases parasympathetic activity, leading to sweating, diarrhea, miosis, and bradycardia. 9. Which of the following is a contraindication to the use of bethanechol? A. Urinary retention. B. Postoperative ileus. C. Glaucoma. D. Asthma. Answer D. Asthma. Explanation. Bethanechol, a muscarinic agonist, can cause bronchoconstriction, which is dangerous in asthmatic patients. 10. A 70-year-old man is diagnosed with open-angle glaucoma. His physician prescribes a drug that activates muscarinic receptors to increase outflow of aqueous humor. Which of the following is the most likely side effect? A. Mydriasis. B. Blurred vision. C. Urinary retention. D. Tachycardia. Answer. Blurred vision. Explanation. Pilocarpine, a muscarinic agonist, contracts the ciliary muscle, leading to blurred vision and difficulty with accommodation. Key takeaways from medical revalidation of Puerto Rico. Bethanechol, used for urinary retention and ileus, stimulates muscarinic receptors. Carbachol, used in glaucoma and eye surgery, has both muscarinic and nicotinic activity. Methacholine, used for asthma diagnosis via bronchial challenge test. Pilocarpine, used for glaucoma, Sjogren's syndrome, and inducing sweat.